Now joining us, excuse me, is the independent statistician, Jamie Jenkins. Jamie, you used to work for the Office of National Statistics. The statistics, how worried are you by the statistics? Explain them on Omicron, if you would.
So obviously we don't know too much about Omicron. Your previous guest was talking about kind of the GP coming down from South Africa saying that it's a mild variant. The Prime Minister's, I don't think he's saying it's not mild. I think he's just saying it's too early to kind of be able to tell that. So if we're looking at the figures of what's going on with COVID at the moment across the country, it's considerably lower than this time last year, about 80% lower than this time last year. The number of patients in hospital depends on which parts of the country you're looking at, but they're upwards of at least 55 to 70% in different countries, lower than this time last year. Patients in intensive care of COVID lower than this time last year as well. So all the metrics are pretty low, and I think that the big panics, obviously, with this getting this booster rollout, is to try and get everybody vaccinated. Now, if you look at the older cases in the country, the older people who've had booster doses, we have seen COVID cases coming down amongst those. So you can see the impact. My big concern with the Prime Minister's announcements being, though, that I think this big drive to vaccinate the whole population yet again down to the age of 18, where we do know that the virus itself, even the current variant, is not so deadly for the younger people, is going to put at risk the elderly's care. We also know as well that at the moment there's around 79,000 or up to 79,000 people in care homes who've had two jabs who haven't had a booster. And we've got on top of that patients or people who are living at home who can't get out of the house. Now, I think the Prime Minister's getting the priorities wrong here in that trying to vaccinate and putting out kind of invites to under 30s. It's just absolutely bonkers when we've got these people who haven't had their boosters yet. And the main problem is it's the Pfizer vaccine itself and the storage of it. And it's difficult to actually get out to some of these places. So I think if you want to save lives, that's the area we should be prioritizing, not kind of cutting off the care to older people to vaccinate the younger ones.
Jamie, the Prime Minister would say that he's exercising the precautionary principle. It's better to be safe than sorry. These are all phrases that cabinet ministers are now using. If you don't go along with that, what would you do to respond to this Omicron variant, if anything?
Well, I think they're talking about kind of being cautious. There's no harm in being cautious, of course. But the measures that are being voted on in Parliament tomorrow, which is Plan B in England, we already have. I'm living in Wales. We've already got them, and we've got them in Scotland. The vaccine passed as very little, to the point that even last Friday, the First Minister in Wales, Mark Drakeford, was talking about everybody having lateral flow tests to leave the home because obviously the vaccine pass hasn't stopped the spread of the virus, really. I think if you were going to look in terms of doing things, obviously vaccinating the most vulnerable people is the critical thing, the people we know are going to be going potentially into hospital. We've seen the effect of all of that. But I think the question really is, how much should you be trying to vaccinate down that age group and then say people who want routine appointments with GPs can't get them? And we know the GP surgeries are generally filled up with older people because they tend to get sicker. So I think the key fact really is vaccinate boosters, get them out as quick as possible to those who need them. Don't rush them down to the age groups and cut off the kind of the care, because we had stats out last week telling us, excessive waits in A&E. And what happens when you can't get a GP appointment and you're ill? You go to A&E. So it's just going to clog up the system even more.
The Prime Minister will have a brutal day in Parliament tomorrow with critics from his own side. However, public support for Plan B, face masks indoors, 80% support, working from home rules, 78%, COVID passports at large events, 72%. As far as the public goes, the Prime Minister's in the right place.
And that's partly why he's going ahead. We've had polls in Wales throughout the pandemic with some of the restrictions that Mark Drakeford is putting in place. I think part of the issue is that a lot of public have been kind of scared over the last 18 months. I think if we actually look at the facts and figures, we're nowhere near in the same place that we were this time last year. And that's a positive thing. And that's been helped by the vaccine rollout. So I think when the Prime Minister's going on national TV, doing addresses to the nation, saying, Omicron, we need to boost everybody. People, I've got kind of memories that will remember this time last year and all the deaths that we saw, thinking that this is the next COVID virus that's going to kind of overwhelm the NHS and kill us all again. You know, I think we are in a much better place than this time last year. We shouldn't be kind of resting on our laurels. We've got to be careful. I think people are acting sensibly, those who, you know, want to be doing that. But I think just bringing in Plan B, you know, the statistics don't suggest it's going to make any material difference, because we've got it in Wales and Scotland. And, you know, I think if you're following the data and following the science, I think Boris, the Prime Minister, has got this one wrong on that aspect.
Jamie Jenkins, thanks a lot for joining us there. Jamie Jenkins, a former ONS statistician.